Geoff Delaney is the Director of Cancer Services at Liverpool Hospital. Geoff, Dry July and Liverpool have been linked up for a couple of years now. 2013 will be year 3. What's the experience been like for you over the last couple of years?
The experience has been very positive, Adam. The first couple of years we were able to raise about $250,000 in total. The first year's money predominantly went into purchasing chemotherapy chairs with DVDs in them, which were a very large hit. And last year we have accumulated $100,000, which we're putting towards our Wellness Centre program.
Tell us about the Wellness Centre, in particular where we are now.
So where we're standing is largely an administrative area that was built at the time the Cancer Therapy Centre was built about 15 years ago. And it's beyond its time and it needs a refurbish. So what we've decided to do is to gut the interior and to develop our Wellness Centre. And that will be a conglomeration of spaces that allow patients to have some quiet areas, some quiet consultations that don't need direct medical input, such as allied health. There'll be acupuncture programs, nutrition. A lot of it will be around counselling as well for patients, both in group and in single sessions. So we hope to have that done in this area in the next 2 months.
And that sounds like the sort of place where Dry July money that's aimed at increasing amenity and making the whole experience less traumatic could really go to great use.
Absolutely, and you know, it was only today I was talking to a patient about the fact that there's really no need for patients to be sitting in waiting spaces waiting for their chemotherapy or their radiotherapy. Come up to the Wellness Centre. They don't have to interact with any of the staff if they don't wish. Come to the library, read a book, they get a buzzer and they get beat down to their chemotherapy or their radiotherapy appointment.
And little things like that seems like a little thing, but if you're doing multiple sessions of chemo over an extended period of time, if each time you're waiting around you're reading a book you enjoy or just relaxing somewhere, that makes a massive difference. Absolutely. Over that amount of time.
Unfortunately, people have to wait because there are blood tests that they have to wait for, or the doctor is overcommitted with patients, or that they're needing to be seen urgently and they're squeezed in between patients. So why wait in what appears like a bus shelter? They should be really managed in a very comfortable environment where they can go away and have some quiet time with their family.
And so if this Wellness Centre fulfilled all the goals you could want, what sort of things would be here? What would be a state-of-the-art Wellness Centre?
I'm glad you asked, Adam, because what we've just talked about is the stage 1 of our 2-stage wellness program. So we intend ultimately to build a wellness centre that is actually off-site and provides those amenities at top class, including a research component to that, to assess the direct impact on patients that wellness centres have in terms of their cancer outcome. And we've got a 3-year plan to build a wellness centre half a block away from Liverpool Hospital.
Well said, Geoff Delaney.
Thank you.
Great stuff, mate.
Thank you.
Brilliant.